A very, very good afternoon if you're joining us from South Africa. And for our international attendees, good morning or good evening, depending on where in the world you're joining us from. My name is Pran Govender, and I have been given this distinct opportunity to host this truly exciting webinar on behalf of Scifest Africa in collaboration with the Nelson Mandela Bay Science and Technology Center. Now, for those of you who have been following some of the various engaging webinars that Scifest has managed to produce, will be glad to note that this series runs right up to March 2022. Now, Creative Sciences is the Scifest Africa theme inspired by the 2021 UNESCO Declaration celebrating the year of creative economies for sustainable development. In today's exciting and informative session, our topic for this afternoon is on healthcare implications of 5G wireless technology, debunking myth and fears. I'm truly honored to host two experts in their respective fields. Our first panelist is Professor Darelle von Geuren. She leads a research engagement and innovation group at Nelson Mandela University, namely the Center for Community Technologies, or CCT. The CCT integrates transdisciplinary research and innovation with community engagement through the development and implementation of apps and other smart technologies that enable the advancement of education, health, rural and social development, particularly in low-income communities. This is combined with training, networking, and policy analysis and advice. She is recognized as one of the handful of innovators for the people and is affectionately known as the People's Professor, who has managed to introduce smart technologies to the man and woman in the street. She was the first joint appointment as a senior researcher between a South African university and the German multinational software corporation, SAP AG, in 2006. Over the past 5 years, Prof. von Geuren and her team of changemaker researchers have won various awards and international acknowledgement for their groundbreaking research and application development within the African context, and thus realizing her vision of ICT solutions for Africa by Africans in Africa. I want to repeat that again. Thus realizing her vision of ICT solutions for Africa by Africans in Africa. She obtained her PhD from the University of South Africa in 2010 and was promoted to full professor in 2012. Prof. von Geuren has published a number of well-cited scientific papers and also acts as external reviewer for a number of international journals and actively assists with the formulation of policy for the South African government. As such, she is then recognized as one of the leading academics in the space of advancing the fourth industrial revolution in education. Welcome, Prof. And then to introduce our second panelist, Ms. Kim Patodi. Kim is an entrepreneur, innovation advocate, and a youth development activist based in Johannesburg, South Africa. Her leadership focuses on sustainable and inclusive economic development on the African continent. Kim holds a certificate in entrepreneurship from the University of Johannesburg, certifications in data science through IBM, and is completing her Bachelor of Consumer Science degree from the University of South Africa. Kim is also the founder of Pulotech Limited, a tech company focused on infrastructure, automation, software development, and cybersecurity. She sits on the advisory board of the National Youth ICT Council, an entity that is focused on driving skills development for youth in the ICT sector and unlocking opportunities for young people in the digital ecosystem. She's also the curator of the World Economic Forum Global Shapers Soweto Hub, which is focused on sustainable community development through impacting the lives of young people. Kim is also the regional deputy chairperson of the Free State chapter, the Circle of Global Businesswomen, and the chairperson of Innovation. Her aim is to drive entrepreneurship and innovation as the core of the continent's development through adequate training and support of young people. Now, to be among such powerful women, I'm truly honored and I'm very humbled and I'm very grateful to Scifest for giving me this opportunity to host this session. Now, to kick off today's session, we are going to start with a presentation from Prof von Geuren. And a kind reminder to all of our attendees, you will note a Q&A box on the bottom of your screen. For those of you who are joining us within the Zoom session, please do post your questions in there. And for those of you who are joining us from Facebook, please do use the Facebook chat feature when we get to the question and answer session. I'm now going to hand over to the very distinguished Prof von Geuren to start her presentation.
Thank you very much for that very illustrious introduction, Pran, and a warm greeting from Nelson Mandela Bay, the city of Gqeberha in the Eastern Cape, the most southern part of South Africa. It is indeed my pleasure and my privilege to speak to you this afternoon about the topic of 5G in support of digital health. We live in very different times, and yes, 2, 3, 4 years ago, this would have been very far removed from our frame of reference. Yet now here we are in a virtual event, busy talking about things that we thought were very futuristic at the time. And now we are part and parcel of that. So I'm going to speak to you a little bit about digital health and how 5G can advantage digital health. I've had the privilege in the time of COVID, and I say the privilege, to work side by side with healthcare professionals in these very challenging times. And I have learned once again the power of technology and how we need to remind ourselves that technology is the glue that brings everything together. So this afternoon, allow me to share a few thoughts with you. I think when we talk about 5G, the most innovative thing about 5G is how we will use that. What do we plan to do with 5G? 5G is available. So how will we apply it so that it works for us to the best of its ability? We live in times where we have seen 1G, 2G, 3G, 4G, and now 5G. So what does this mean for us? So let us explore that in a little bit more detail. I think first and foremost, it is important to understand that we need to transform our healthcare across the continuum of care. The time of COVID has probably taught us quite a few lessons in this space, and has also allowed us to leapfrog certain things in many ways. So what does 5G bring to the party? First and foremost, it will bring reliable, ultra-fast acceleration of predictive medicine, telemedicine, virtual consultations, and even home healthcare services. So just for a moment, let us think about the whole issue of virtual consultations, telemedicine. We are still in the middle of a pandemic. This afternoon in South Africa, we heard the news that there is yet more mutations of the Delta variant. We are more than likely on the brink of going into another lockdown of some sorts. And what we need to ask ourselves is, what can we do with technology to make this situation better? We've learned in the time of COVID in particular, how important data is. So when looking at the use of 5G and then healthcare and technology, we need to understand that medical data is becoming central to the healthcare continuum. And we need to ensure that our healthcare professionals have access to this data and to connected equipment to allow them to do certain things in real time. We need to understand that we can advance our technologies that underpin the future medicine and surgery using Internet of Things, or then even Internet of Medical Things, artificial intelligence, edge computing, real-time video. Here we are in real-time video, augmented reality. We can do virtual consultations using the data that we collect with telemedicine to do predictive medicine and ensure that we offer a better service to the population, not only in South Africa, but in Africa and globally. So for a moment, let me pause and see what are the ways that 5G will transform healthcare, in my opinion. So in days gone by, when you became ill, it was very easy to seek medical attention. You just got in your car and went to a doctor or the closest ER facility, trauma unit, hospital. That is, if you live in an urban area. If you live in a deep rural area, and as you know, I'm in the Eastern Cape province, which has large remote rural areas. How do you reach a medical practitioner? How do you get to your closest healthcare facility? It can be very challenging and very time consuming, and sometimes actually fatal because someone cannot get to a healthcare facility in time. Or it can take days. We all know the queues and the long waits at public healthcare facilities. So 5G offers us the opportunity to change that and to ensure that we can honor the e-health and m-health strategy of South Africa that says it will offer good healthcare services to all the citizens of our country. So how do we change that? We can use systems like telehealth solutions, remote home monitoring systems to receive care from the comfort of our homes. So whether you are in an urban area in the city of Gqeberha, or you are out in Matatiele or Kunu or Tsoma or any of those places, you can actually connect with a healthcare professional from that area and receive advice as to what you need to do. And it can just be a short video call or a short WhatsApp call, just so that you know what are the next steps. We are even at the point now where medication is delivered using drone technology. So that is how far we've advanced. Of course, as with everything, there's always a little bit of a downside. It means that this could impact on slower networks and the bandwidth that is available. And it can also delay patient care. So if we want to go that route, that is why we need 5G. 5G simply has the potential to help resolve these challenges. It is a growing demand of digital transformation, and we need innovative ways to do just that. So let's look at some of the examples that can be used. Transmitting large imaging files. When dealing with serious healthcare conditions, you need MRI scans or CT scans or PET scans, the likes thereof. Those produce very, very large images that need to be transmitted and transferred to a specialist for review. So let us imagine you are based in Matatiele and the closest specialist is in Mthatha at the Nelson Mandela Academic Hospital. How will they transfer a scan image from Matatiele to Mthatha for a specialist to review? 5G could assist in that. The image that you see on the screen there can be as big as 1 gigabyte per patient per image. So how do we transfer that? If our network is low on bandwidth and the speed is not good, the transmission will take a long time. It will become granular when it is sending the image. The patient needs to wait. Maybe there was a head injury, a trauma, or something like that. So how does the healthcare professional then review this image? If we add high-speed 5G to our networks, the existing architecture can help to quickly and reliably transport this image. It literally can be like this. A snap of your finger is the time that it will take to transfer the image using 5G. And that, of course, can enhance access to care, but also the quality of care. Telemedicine, this is something that we've become accustomed to in the time of COVID. I'm sure there are many people watching tonight who've had to see a doctor in this time. What is the first thing they ask you when you make an appointment? If you go to a private practice, you undergo a COVID screening test. If you have COVID symptoms, what do they say? You will have a telephonic consultation. So using telemedicine, that is now a reality. So your healthcare professional can sit in the comfort of his or her consultation rooms. You are in your space of comfort and you connect with your healthcare professional via telemedicine. Of course, again, there's always some basic elements that need to be there. You need a network that can support real-time, high-quality video. Again, with 5G, healthcare systems can enable mobile networks to handle telemedicine, which can greatly increase the reach of the program. Telemedicine is used with great success in the treatment of different dermatology issues, used in radiology, in ophthalmology, etc. There are so many uses of it already in South Africa, mind you, I have to add. But the ultimate outcome of that is that people can get to treatment sooner and have access to specialists that they may not have had before. So if you're sitting in Matatiele, you can connect with a specialist in Mthatha Academic Hospital and speak to them and get their opinion on something. Some of the other areas that we need to start investigating and look at is that of augmented reality. At Nelson Mandela University, we are on the eve of launching the 10th medical school in the country. I'm proud to say that our medical school has state-of-the-art artificial intelligence, virtual reality, spatial computing facilities that they will use to train up the doctors of the future to ensure that they can do innovative and less invasive treatments as they go forward with state-of-the-art technology. Some of the ultimate potential applications are those where we do simulations of very complex medical scenarios, and it allows us to enable alternative treatments for the critically ill. On the screen here, you see a simulation of a brain with a stem attached to that in the form of a hologram. These are medical students who are busy learning how to work with a brain and surgery of the brain. How innovative is that? It may sound very futuristic. A few years ago, a hologram was something completely unheard of. Now it is almost an everyday occurrence. Real-time remote monitoring. Again, if you have very critical ill people with difficult situations and you need a specialist to do real-time monitoring, it can happen via 5G, given that the bandwidth is there and that there's good connectivity, then you are ready to go. In this particular instance, what you see on the screen is someone monitoring, a medical doctor, a pregnant woman who's about to go into labor. There are some intricate machines on the bottom left-hand corner. The top has an ECG machine, and the bottom right-hand corner is monitoring someone who is in a mental health institution and who needs some intervention there. All of this is happening real time. Now, what this enables is instant intervention and instant assistance of care to the needy. When we talk about artificial intelligence, there are just so many solutions that we can look at. And I've just put a few of them on the screen. There's artificially assisted robotic surgery. We have oncologists in South Africa who sit in their surgery in Gqeberha, for example, and do brain surgery on a patient in Gauteng using artificially assisted robotic surgery. We have virtual nursing assistants. And again, in the time of COVID, that has become really, really important. We have infectious diseases. So how do we use virtual nursing assistants to assist patients with their basic needs. There's assisted medical diagnosis, image analysis, drug discovery, fraud detection, clinical trials, medical risk prediction, automated workflow assistance, medical data security. The list goes on and on. And this is only but scraping the surface of using artificial intelligence in healthcare. We are on the brink of new, innovative, and really creative solutions. So what do we need to do in South Africa and in Africa? I think it is important that we start preparing for change. Change is inevitable. So you have a choice. You either change and adopt and adapt to the new systems, or it will force you to do that. Obviously, it is always better to go and be ahead of your game and work with the change as we go. So I say there, by enabling all these technology through 5G networks, healthcare systems can improve the quality of care and patient experience. It can also reduce the cost of care and so much more. I have just touched the surface of what is possible. I want to say that instead of only reacting to patients' conditions, 5G networks can give service providers and governments the ability to provide more personalized and preventative care, which is the reason why many healthcare employees become providers in the first place. The aim is not to respond to a medical crisis. The aim is to prevent a medical crisis. If we introduce 5G networks into our society, into our healthcare systems, into how we treat people and how we use the continuum of care to look after our citizens, then we can do preventative care. And with that, I would like to say thank you very much for listening to me, and I'm looking forward to a very interactive discussion. Thank you.
And with that, I want to say a very, very, very big thank you to Prof. van Geuren. I think that just listening to your presentation makes me very grateful to be alive during the fourth industrial revolution and all of the possibilities that is currently presented to us, and technologies which 20 years ago would have seemed extremely far-fetched. Now, you have really gone in depth and sort of opened us up to, especially, during the time of COVID and this pandemic, the possibilities of 5G network and how this will actually enable us to do so much more than we currently can, especially in South Africa, where we know that medical care, especially in rural communities, in deep rural communities, is very difficult. So I just want to remind our attendees again, if you have questions, please do post them in the chat if you're in the Zoom panel with us. And if you're on Facebook, please use the chat function there. So Prof, just to start off this conversation, I want to throw something at you, please. So it's an exciting time. There are many, and we're going to get into the myths and the fears of 5G technology. But in terms of the actual implementation of infrastructure and the development of infrastructure that's required to host 5G technologies in our clinics, in our hospitals, what do you think the future holds in terms of that time frame of how this will roll out? Any thoughts on that?
Thank you, Pran. Yes, I think there's already quite extensive use of some of these technologies, and that we are just not aware of the fact that they are being used. And as I said, COVID has probably forced us to leapfrog into some of these situations, given the fact that we are in the midst of a pandemic, and this is where we find ourselves now. So it necessitated the shortening of time frames. So in some instances, I think in our urban areas, the access to this kind of technology is already there. We see that our technology footprint in our rural areas has increased significantly now. When you go out into the rural areas, you will find that in healthcare facilities, people have tablets that they use to screen patients. They're capturing data. And there's a great move in the public sector now, in the public health sector, to introduce electronic health records and ensure that everything integrates and is interoperable. So I would say where the National Health Insurance, the NHI, was maybe something that we all doubted whether it will happen in our lifetime and will it materialize. I do believe that is now a lot closer than what we thought it would be. And given the next 2 to 3 years, we can see probably the first implementations thereof, given that our infrastructure footprint has been enhanced through COVID. COVID has been terrible, but it's also brought some good things with it. And I think we need to acknowledge that. And we also need to acknowledge that COVID has become not only a National Department of Health or a healthcare professional issue. The understanding that healthcare is now our own responsibility as well has brought many different people and groupings, sectors together. And I'm sure Kim will also speak to some of that, where we have seen different disciplines and sectors taking hands to work together to beat this terrible pandemic that we are in, but at the same time to enhance where we are going in the foreseeable future.
Wonderful. Thank you very much for that answer. Kim, welcome once again, and thank you very much for joining us. Kim, just to spark some conversation and get started, one of the questions I'd like to throw your way is, working with the youth, we've understood that one of the biggest impacted areas would have been the education sector during the COVID-19 pandemic. How, Kim, do you think that such technology and implementation of 5G networks could aid our system from going to more classroom-based initiatives and teaching to actually adopting, growing, understanding, and implementing digital platforms into our South African classrooms? Any thoughts on that, Kim?
Thank you so much, and I'm really glad to be here, actually. It's fantastic. So just on that note, going back to the beginning of perhaps the root of our conversation, I would like to start on the impact of COVID as a whole in our education system, right, and the education of young people. So first of all, with COVID, there are two things that I think are major that happened, good and bad. The good thing is that, students like myself who are part of UNISA, who've been used to distance learning, were not, perhaps too perturbed. However, everybody else realized, what distance learning actually is and how possible it is to take your education upon yourself online and still complete it, right? This is from, I'd say, maybe teenagers to university. And the bad side of it, I think, was that we also realized how important it is for people to be connected to access education. So it adds another barrier of entry to the education system of the country. You're not only looking at school fees and textbooks anymore, you're also looking at, basic connectivity. And that's where you realize, the gap is quite large and it's quite important to address. So coming back to your question, the opportunities that I do see technology aiding with in terms of our education system is that if we are able to bridge the connectivity gap, what we can do with our education system, number one, we are able to reach the unreachable, right? We are able to assist people from their localities where they are. So you don't have students having to come to Johannesburg to pay, exorbitant of money for res and, other matters, pocket money and so forth for parents who cannot afford. If kids have connectivity, they can go online and get their education. That's number two. Number three, you've got a wide array of opportunities to study from different institutions and organizations, right? So I think what I've liked about it is that it's helped decentralize the education system and innovated it in a way that people can choose, perhaps not to start with pursuing a full-time, 3-year degree of NQF perhaps 7 or 10. However, they can start with certifications that build up their skills, which makes it far more exciting, because I think for a lot of young people, what young people are looking to do is to perhaps understand who they are before they commit, to studying full-time for a 3-4 year period. So that's another opportunity that I've realized. Another opportunity I've realized is that we ourselves can start building educational modules, right? And assisting in terms of informing and innovating the education space. Because what you find is that certain fields are always, born the next couple of days, the next couple of months. Certain jobs, didn't exist last year, but exist today. Certain jobs didn't exist 10 years ago, but are perhaps the highest paying jobs today. What is a data scientist? So I think those are the opportunities that technology has presented us. And having 5G technology, which is, a technology that we pretty much have had, it's an upgrade of what we've been using, right? So if you have a cell phone, you pretty much have been using the same technology. So as an upgrade, it means faster connectivity to wireless internet. And therefore, if we can build the right infrastructure across the country, we can access more people, make it more affordable, and therefore education will not have the barriers of entry that it does today, where a person has to take their last 50 rand, take a taxi to a city they don't know, be uncomfortable, and their odds are completely stacked against them. They can study from the comfort of their homes, and now thanks to technology, they can also be employed overseas. I mean, one of our developers was recently employed in New York, sitting from, where he is in the Eastern Cape. So it's absolutely amazing. So I'm quite excited about all of the opportunities that arise. Thank you.
Okay, thank you so much for sharing that with us. And I think if we're looking at just the replies from both of you, what COVID has done in a very beautifully disruptive way has actually forced us out of our comfort zone and forced us to embrace technologies and technological experiences that we would have otherwise not wanted to do. If there's one thing I think after reading many books I understand about human beings, is that they're very change resistant. But, pandemics such as COVID physically forces us out of that comfort zone, and where there are times where we need to relearn, we need to rethink, and giving us these experiences. And I think you both have summarized it very, very beautifully of what technology such as 5G implementation holds for our future. So moving into, so we've covered some of the uses, and we can see the uses of technology are always endless, right? And not just in specific fields, developed for one field, but we know that, a multidisciplinary approach to technology is become the norm. Anything developed in one sector is actually used in various other sectors for various means. And as we commonly refer to them as spin-offs, taking us from things like the invention of Wi-Fi or the MRI, right? Beautiful spin-offs that have actually changed the way we do things in the medical field and with technology. So getting to some of the myths that are associated with 5G technology. Now, Prof, I'm going to send this your way. Is there any evidence whatsoever associating 5G technology with the COVID-19 global pandemic? And if yes or no, can you tell us why we have these speculations floating around social media at this point in time? What sparks this?
Thanks, Bran. Yes, I smile because in this time of COVID, this is a question that we've had so many times. And it amazes me how people come up with these conspiracy theories and the types of conspiracy theories that they find. So the first thing is that 5G and COVID was coincidental, that 5G was launched when the pandemic struck. So it was just, well, maybe bad timing, good timing, I don't know, but that is how it worked. There is absolutely no scientific evidence that suggests a link between 5G and COVID or the SARS-CoV-2 virus. we have not come across any information, any credible scientific evidence that can support that. And as I've indicated, I've worked with the scientific community as well as the medical community, and there is definitely absolutely no evidence whatsoever. 5G, in fact, is very similar to many other wireless technologies that we use, and we don't even think about that. I mean, people have remote controls for their houses, their alarm systems, their garage doors, their Wi-Fi, their Bluetooth, their whatever. That's all wireless communication. That's no different to 5G. So it just coincided. If you think about it, where some of the rollouts that happened prior to COVID, that didn't result in the disease. In Korea, for example, they started with the rollout long before there was COVID. So in the rest of the world, it was just a pure coincidence. So I think, why did it become such a thing? It's a social media thing. It's sensational, you know. So a few people started trending on Twitter with this and making some comments, and it became sexy to tweet about that. And then a whole thread was developed, and it became sensational. And from there, it just spiraled out of control. And now you have the likes of people who believe that, you know, Bill Gates was behind this, and the 5G chips in the in the vaccine. Those of us who've had the vaccine will be absolutely astonished if we can fit a chip through that needle. I mean, that will be really revolutionary if we get that one right. So, yeah, I mean, as I say, I think it was just a coincidence, and there is absolutely no scientific evidence whatsoever. So I think what people need to remind themselves is that wireless communication has been here long before 5G. And so has microwaving and all of those kinds of initiatives. So let us not just now fixate on one thing and make that a problem suddenly, where we actually have a wonderful solution to move forward with.
Thank you very much for that. And please forgive the smiles. Just listening to you speak, I'm reminded of all of the social media trends that went around regarding 5Gs and chips being implanted into our arms. And I've seen people be, sort of scanning and finding chips. So all of these things to sensationalize media and to get views and to get followers. Now, social media is so imperative to our growth, to our understanding, to our embracing one another. The one thing that I was, really comforted by when looking at the current trends in social media is how much I can learn from, different countries and different people and different ethnicities and everything that makes the world a beautiful place. But with that comes this dark sides of sensationalizing things to get followers and to get tweets and to, and this really can be a really, really difficult thing for us to try to control. Another article that was trending quite recently is the low vaccination rate of youth, right, in South Africa at this point. Now, we do know that COVID-19, the vaccines have been shown to really limit death and ensure that we are kept safe. Now, at a time like December, when we're going to meeting families and when we want to actually interact with people, having much of our population, especially our youth, right, who are very active, and adults who are going to be moving around unvaccinated, poses very, very serious threats and could spur on this fourth wave that we're talking about. So Kim, back to you. In society where misinformation is basically the order of the day, how can we ensure that our population is informed and afforded the capacity to take advantage of emerging technology rather than shying away from it? And while I say this, I know that misinformation spreads faster than actual info. So how do we tackle this?
Thank you very much. I do think that currently, looking at the state of our youth also not voting. right? They're not voting, they're not vaccinating, but they are not happy with government. They're not happy with COVID. They do not want to stay home. They do not want to wear masks. They do not want to. So that one is a bit of a tricky one in terms of finding the actual root cause of not wanting to vaccinate, right? Because I know that a lot of the conspiracies are from the older generations, right? And they are from certain groups that I would say are societal groups, like perhaps religious groups or community groups, or, you know, where people are huddled up and sharing information amongst one another. But in terms of addressing, okay, so I think I have two, you know, thoughts around the misinformation, the myths, the conspiracy theories. Number one, everything is subject to change, but humans are resistant to change, right? So that fear is automatic in any change that does come. And we should expect resistance to some of the things that do come. And secondly, I believe this is, you know, part of evolution for us, right? Looking at the next leap of humanity. This is what I see the fourth industrial revolution as. And 5G is one of those tools for the 4IR, you know, for us moving forward. So in this evolution, as you can imagine, I can imagine the guys in the Stone Age probably didn't believe that, look, if you don't run from a dinosaur, it's going to crush you. Or if you know, I'm just trying to think about some of the logic that was still inherent in the human nature. So what you would find sometimes is that people want to resist logic, and they want to follow what seems popular because there has to be somebody against all of us, right? So when it comes to addressing misinformation towards our population, I think with regards to young people, so far from what I've seen, right, there's been a lot of influence on social media, pro-vaccination. There's been a lot of influence on different media platforms that are pro-vaccination. There's been campaigns, there have been drives. And I think what needs to be done, in my opinion, is to keep informing, just keep informing, keep encouraging, and keep reassuring. I mean, there are people who are going to stick with their conspiracies throughout. And I will not lie, I do not believe that, you know, absolutely everybody would give in to logic at some point. But for those who are willing to listen, we just need to keep educating, keep informing, and keep sharing the benefits, because what is the biggest driver of fear is a lack of knowledge, right? And that's how people jump onto conclusions and conspiracies very quickly. So if we keep using different channels to inform, to encourage, that will keep working, because it won't be an overnight change, but it will be a trickle effect where others see their peers, you know, going for vaccinations all times. And, you know, with just watching and seeing the impact of vaccinations, so perhaps reporting the positive results as well of what the vaccinations have done. I mean, we haven't had cases of deaths in a while, you know, since vaccinations have been rolled out. So just keep informing people, keep informing people. However, I do believe there's another group of people that, you know, perhaps need more grassroots education. And these, for me, are the marginalized and the people in the rural areas, right? So we are talking about informing people via media, social media, etc. And where do they have access to these platforms and channels? However, they would have access to a church, they would have access to a community hall, they would have access to a societal group, a school, you know, where this information is spread. So you use the localities to then drive these campaigns and inform people about how, you know, the benefit of technology actually is, and how much it would be, you know, helpful for them. So moving just on informing people on 5G and technology, because I think we got into vaccines for a bit, but moving on to informing people about 5G and technology, I think just break it down, make it simple, right? As somebody who works in IT, I get confused sometimes because people use big jargons that I can't relate to. You take it back to, say, when we first had the iPhone, did anybody get a flu? Was there wide pandemic spreading of people getting sick? But that was a smartphone and it used the same technology, right? So breaking it down and simplifying it for everyday users, and, you know, examples like Prof pointed out, looking at, you know, wireless technologies that have already been in use, like garage systems, Bluetooth, etc. I think informing people on that would assist them in understanding, first of all, that technology has existed, it still exists, and then we can build up on the actual benefits, you know, that arise from 5G technology. And fine, we've used it up to this capacity so far, and what we can do with it in the future means a scope of, you know, better digital access to, you know, global platforms. It means better innovation in every sector. It means being able to trace where your food comes from. It means being able to detect illness early. It means being able, to monitor machinery and vehicles and, prevent damage or prevent malfunction early. It means being able to, communicate and connect with people you wouldn't have communicated with before. So I believe that that's the approach we can use. I do believe that we can't use the same approach in the cities and the towns and where people already have internet access and resources and materials as we do in the rural areas. Those need to be, addressed individually so that you address people at their point of understanding and need, and you are able to then make an impact instead of throw big jargon words at them without any real, impact, and still then face resistance and change of people burning towers, burning base stations because they fear what you're pushing onto them instead of bringing them in to be a part of it. I think then, of course, I'm an advocate for skills development and inclusivity. So part of my informing and empowering would definitely come back to, let's bring them in and train them on how to use these devices while we are educating and teaching. So yes, that's my long answer, but thank you. It was a loaded question.
And thank you so much for eloquently answering my very, very loaded question. Thank you very much. That is a very eloquent answer. So, Prof, back to you. There are some current potential fears around the adverse effects that 5G technology could have, or emissions and radiation from 5G technology could have on human beings. What do you say about this? Is there an actual reason for us to really be concerned? And also, has there been enough research done on the effects on human beings?
For a moment, I lost my unmute button there. So no, let me first say there's never enough research. We can always do more research. So I think as things change, as they evolve, then we really need to focus, on ensuring that we stay up to date in terms of that. But when we look at the whole issue of yes, there's always with the positive, there's also a negative always that comes with that. But in terms of the impact of radiation and the likes thereof, there is, again, absolutely no scientific evidence that shows that the human body is impacted by any radiation that emanates from a cell phone device or then a 5G enabled device. I think we need to also just interrogate a little bit more what is meant by radiation and electromagnetic waves and signals. Often we, and as Kim just said now, people use big words and terminologies and so on that they don't necessarily understand. So it's a question of unpacking this into simple everyday language. Do not speak about words and things that you don't necessarily understand. People think it's very sexy and smart to use, terminology and words and things like that. So if we go and unpack what does radiation mean, what does microwaving mean, and I'm not referring to your microwave oven in your kitchen. What is in a microwave in terms of the SKA environment, for example, which, I mean, you're far better qualified than what I am to talk about that. But so if we unpack those terms so that people actually truly understand that and understand what it means, then we will also do away with a lot of these myths and false perceptions that we have. So I think a lot of what we're talking about is coming back to education and ensuring that people have the right knowledge at hand so that they don't just believe whatever comes their way, and that we inform them properly in terms of this. To me, that is really the crux of the matter. It almost, I don't want to say reduce it to semantics, because it's more than semantics, but you need to unpack the words and understand the definitions thereof and what it means. So when you hear the word radiation, there's no need to go into orbit and move away and think, okay, I'm going to be, like some science fiction movie, melted on the spot or something like that. That is not the case. So education and reading the right material. And as much as, I'm an IT person as well, don't believe everything that you read on Google. Ensure that you read from scientific sources. And there are loads of these available. The CSIR happened to have put together a fact sheet on 5G. And, I would encourage members of the public to go and read that and see for themselves, because there's a lot of scientific evidence speaking to exactly these questions that you are raising now.
Perfect. And as you touched on it, big scientific projects that take place and use radio frequency require stable connectivity, require this kind of connection in order for us to move ahead with these massive projects that are currently being implemented right here in South Africa. So there's something, Kim, that you touched on, which I'm also extremely passionate about, right? And that's the use of development and skills development specifically for embracing everything that Prof has spoken about, for embracing these technologies, for ensuring that we have a fair distribution of this kind of 5G technology, as well as the individuals who are able to use it and able to exploit this technology for the benefits of our various sectors. Now, Kim, something that we did acknowledge when we started up this session is that we do have a digital divide, and in South Africa, it's very large. How then, Kim, can you kind of encourage, or what then would be your views on, the stance of the younger generation and using 5G technology, but at the same time having the necessary skills to embrace it and develop as everyone else is in countries that already have this technology?
Thank you. I think those were two questions, right? So I wanted to start with the first one. The stance of the youth regarding 5G technology. Well, the young people of the country are excited about Wi-Fi. They're excited about connectivity. They're excited about the improvement of systems of things, excited about innovation. So therefore, they're excited about 5G technology, unawares that this is 5G technology that I'm excited about, because 5G technology for me is an infrastructure, that is an enabler for this fast connectivity that they all want. It is an enabler for this endless connectivity that they all want. It's an enabler and it's a tool for the innovation and the inventions that they want to build, right? So in my stance, they would be excited about it, right? Currently, as we stand, how 5G was introduced, unfortunately, coincided with the COVID-19. And therefore, that's when people became apprehensive without trying to understand first what this technology is. If there was no COVID-19, nobody would have opposed anything. Nobody would have questioned anything. Everybody would have been excited, faster internet, woohoo, right? Because we all know the frustrations of slow connectivity in this day and age. So my stance is that the sentiment is excited and perhaps ill-informed in some spaces, right? A good number of young people are just ill-informed. And when it comes to skills development and perhaps taking advantage of this technology, for me currently, look, what I've seen in South Africa currently from the mandates that we have in government departments, educational institutions, the mandate is for skills development towards the fourth industrial revolution, right? The Future Jobs Report from the World Economic Forum of 2020 listed the jobs of the future, or the skills required to be employable and to be effective in the future. And all of those skills, you would find there's skills that still need to grow. Sorry, there are skills that still will be active in our industries for years to come. And there are some skills that are becoming obsolete, based on what we've been taught decades ago. So I do believe that skills development is critical. I do believe that the work is being done is fine. However, to empower the young people whose skills we are developing. We still need to give them fast and affordable internet. We still need to inform them and empower them on these tools and internet devices that they use, these tools and internet platforms that they use. We still need to then, also bring them into the digital ecosystem to understand the fullness of its value chain. And that's how we can then assist and empower young people to take advantage of the digital economy, the digital future, the digital landscape, not only locally, but also globally. And in that way, once we've developed skills locally, we also have then developed problem solvers in different industries and spaces that can actually effectively use technology. So that is, I'll pause it right there.
Perfect, Kim. Thank you so much for that. And just a question that's come through from our chat from Yandisa. Yandisa says, thank you very much, Prof, for an insightful talk. As we know, with every technology/application, there are usually pros and cons. And Yandisa basically just wants us to expand briefly on some of the cons of using especially 5G technology in the healthcare system.
Thank you. Yes, and I think it's very important that we also do focus on, and let me say not cons, but rather maybe the challenges of implementing 5G, because ultimately the pros probably outweigh the cons. But I do think that there are some challenges and some issues that we need to consider at this point in time. Of course, the infrastructure challenges that we really need to address within specifically our rural areas. And then, of course, one of the big issues is that of data security, cybersecurity. I think there's still a lot of work that needs to be done around that. We are starting to understand the implications, but we do not have it all in hand as yet. And then I think the third most important one, in my own opinion, is that of the regulatory environment. How do we deal with this from a regulatory perspective? I think, again, we are starting with the new acts that have been passed, and we see the challenges that have come with that in terms of WhatsApp groups and the likes thereof. So when we roll 5G out in its entirety and using it in healthcare, what are the medical legal implications of that? Let me use an example. I'm a specialist consulting remotely. There is a healthcare professional in the room with the patient, and I'm consulting as the specialist. Something happens, the patient is ill and happens to die in the process. Who's held responsible or accountable for that? Those are some of the challenges that we still need to consider, because we haven't actually crossed that bridge yet. And I believe those discussions are happening, not only in South Africa, but globally as well. And those are the kinds of things that we need to look at. From an infrastructure perspective, those are small hurdles that we can overcome. These are the bigger hurdles that we need to look at. And those may be some of the cons that hold back the implementation in specific sectors and areas, because we still need to resolve those issues.
Thank you very much for that. And Yandisa, I hope that answers your question. I think that was quite a bit there that we've touched on in terms of the cons. Prof, last question to you. How can laws and regulation be designed to strike that balance between the fast tracking of the 5G technology, and also keeping in mind the point that you just brought up in terms of the cons, ensuring that we have the adequate safety features in terms of cybersecurity, and lastly, just making sure that we can allay the fears of the naysayers in terms of the health implications? Do you think we need redesigning of some of our laws? And what are your views on this?
Yes, a very important question. And I think, let me start with your very last point. Yes, I do believe that we need to redesign some of our laws and review that. It's always good to review certain things as times change. what would also be probably very useful is to have a regulatory body in place, like we have in healthcare. I mean, SAPRA, people who never knew of SAPRA now know of SAPRA because of the vaccines, etc. So we need similar bodies to regulate that. And yes, we have the ICASAs and everything else of the world, but I think there are unexplored areas in terms of 5G, and then going into the different sectors. Let us not just focus on the health sector, but looking at rolling out 5G per se. What are the areas that we need to focus on? And ultimately, we've spoken a lot in this time and saying that people are resistant to change, etc. And how will we manage the change that is to come in terms of not only legislation, but also in terms of people responding to that change within a regulatory framework? And I think what is important is that such frameworks need to be founded in concrete scientific evidence. We cannot waste time with just people's opinions or political views or things like that. This is a scientific matter. So let us focus on producing scientific evidence to inform policies and legislation, our laws as we go forward, because then at least nobody can accuse us of being subjective or biased in what we are saying. It is absolutely critically important. And of course, science councils, academic institutions, but not only those, they need to work hand in hand with interdisciplinary teams to ensure that this moves forward. And I think only if we do that, will we be able to ensure that this is successful in how we implement it. And the last point that I want to make is, as much as I say all the scientific evidence and everything else, let us not forget the voice of the man in the street, the person who is the recipient or the beneficiary of using the 5G technology. Because as much as what we who are doing all the research and all of that have an opinion, those persons also have opinions. And in fact, at the end of the day, often their opinions are far more important and far more spot on than all the research in the world that we do.
Thank you so much, Prof. And I think that's a beautiful point just before we close the session, that the actual end user to all of this is the common man and woman, on the street, to ensure that they are the beneficiaries to this kind of technology. Kim, the last one that I want to throw your way just before we conclude this session. So we've spoken at length about some of the opportunities. We've spoken at length about the digital divide. And the last point we touched on are laws. Now, Kim, I think the reality that some of us face in the country is that we know, when we're understanding 5G rollout and we're understanding the actual users, many of these will be based in our urban areas. Many of the exploitation of the 5G technology may very well be first used and first developed in the urban areas, giving wide access to everyone there. Kim, do you think that implementation of certain laws, ensuring that 5G implementation technology and actually getting our youth to come in from the rural settings and giving them opportunities could be something that could be looked into as well in terms of our laws of the country? What are your views on that?
Thanks, Pranesh. I'll just be very brief. In short, yes, it's something that can and should be looked into. And as the National Youth ICT Council, I mean, that's the work we advocate for, right? To be a voice of the young people, across all sectors in South Africa. So I do believe that in terms of policy conversation, in terms of decision-making, young people need to be at the table. Young people need to be represented. Different backgrounds need to be represented. And there is no form of business that can take place legally in this country that does not follow the policy that is set by officials. So academics, leaders, young representatives need to sit down, get together, and once the rollout begins, if there is, evident, if there's evident division and lack of fairness, that is when we, the voices and the advocates of youth, come to the table and demand that we sit down and relook at these things, based on the impact, the long-term impact that it'll have on the youth of South Africa. How do you fix unemployment if you're not willing to skill people to be employable in this age and moving forward? So I do also believe for all the young people who are perhaps, on this platform, you need to get active as well. Where you find the platforms to contribute, membership-based organizations, have your voice spoken for. If you're in an area where you know that nobody else looks at the wellness of these people and the future of these young people, that is your voice that would make a difference. So I do believe in our corners where we are, once we come together to be active for the things that matter and in the improvement of people's lives from an individual capacity, as well as from a community perspective, a difference can be made. Nothing is impossible.
Thank you so much for that, Kim. Listening to you speak reassures me that South Africa is in fact in good hands, and we will definitely prosper as a country and as a nation. And Prof, with everything that you are doing in terms of your research and technology, I know that the digital divide with South Africa and the rest of the world will soon close. And all of these will come to aid and better our futures. With this, I want to thank both of you very sincerely on behalf of Scifest Africa and its co-host, the Nelson Mandela Bay Science and Technology Center, for what I think was an exciting and fantastic webinar session. And I'm sure that this will really, really dispel some of the fears, the myths, together with the opportunities that are inherent in this 5G technology as we go forward. And with that, I want to thank all of our attendees, both in the Zoom session and on Facebook, for joining us on this session, and to remember to follow Scifest on its social media platforms and on its website to ensure that you kept up to date with all of the future events, the future webinar sessions that Scifest will arrange. I want to thank all of you very much, especially to our two panelists who've done a fantastic job today. On behalf of Scifest again and the Nelson Mandela Bay Science and Technology Center. And with that, we sign off for this evening. Thank you very much for joining us.